Erectile dysfunction and high cholesterol. Is there a link? High cholesterol is a risk factor for many conditions, including erectile dysfunction or ED. Erectile dysfunction is a condition in which a person with a penis is unable to get or maintain an erection sufficient for sexual intercourse, although it is not usual to have this issue occasionally. People with erectile dysfunction experience it regularly. There are several risk factors for developing erectile dysfunction, and high cholesterol can be one of them. Is there a link? There are some links between erectile dysfunction and high cholesterol. Generally speaking, erectile dysfunction is usually a symptom of another underlying health condition. In many cases, the underlying condition affects blood flow around the body, and this is what leads to erectile dysfunction. Examples of conditions that can lead to erectile dysfunction include diabetes, heart disease, blood vessel disease, atherosclerosis, high blood pressure, Peyronie's disease. High cholesterol is an associated risk factor for many of these conditions, and therefore it can also increase a person's likelihood of having erectile dysfunction. Cholesterol is a waxy substance that is present in the blood. It is essential for several bodily functions such as building new tissue and producing bile and sex hormones. Although cholesterol is essential, too much can cause a lot of health problems. There are two main types of cholesterol: high density lipoprotein or HDL and low density lipoprotein or LDL. LDL cholesterol is the type that causes problems. It can stick to the inside of arteries, leading to a buildup of atheroma, a fatty substance that narrows the arteries and makes it difficult for blood to pass through. The accumulation of this substance is called atherosclerosis, and it can cause some severe complications, including an increased risk of erectile dysfunction. Statins. Statins are the most common medication for treating high cholesterol in people over the age of 10 years. To lower cholesterol, doctors typically prescribe statins along with lifestyle changes such as regular exercise and a healthful diet. Statins slow down the production of cholesterol. They block HMG-CoA reductase, which is a protein that the body needs for cholesterol production in the liver. In response to the inhibition of this protein, the body creates more receptors that remove cholesterol from the body. Statins are effective in reducing high LDL cholesterol levels. Some people who are at risk of heart disease take statins regularly, which is relatively safe to do. However, they can cause some side effects that may include headaches, stomach pain, bloating, nausea, diarrhea, rash, pins and needles. Statins can help people with erectile dysfunction if the cause relates to high cholesterol. For example, someone with atherosclerosis may experience erectile dysfunction as a symptom of their condition. Treating atherosclerosis with statins may, before, lead to a decrease in erectile dysfunction symptoms. For this reason, it is unlikely that doctors will start to prescribe statins for treating erectile dysfunction anytime soon. However, they will prescribe statins to treat high cholesterol in people who also have erectile dysfunction. Other causes of erectile dysfunction. Erectile dysfunction is generally the result of problems with blood flow, nerve supply, or hormone levels. Physical health conditions relating to high cholesterol, such as heart and blood vessel diseases, may be responsible for these issues. Other physical risk factors for erectile dysfunction can include obesity, injury to the penis or surrounding area, smoking, alcohol use, use of illicit drugs such as cocaine, surgery, chronic kidney disease, multiple sclerosis, cancer treatments such as radiation therapy. Some medications can also cause erectile dysfunction as a side effect. Examples of this include blood pressure drugs, anti-androgens, antidepressants, sedatives, appetite suppressants, ulcer medications. It is also possible that certain psychological factors, for example low self-esteem or anxiety, could cause erectile dysfunction. Erectile dysfunction is the inability to get or maintain an erection. High cholesterol is a risk factor for many conditions that can lead to erectile dysfunction, such as heart disease. People with high cholesterol are more likely to have erectile dysfunction because of this link. Statins are a common treatment for lowering cholesterol levels and could be useful in treating erectile dysfunction. There are many other possible causes of erectile dysfunction. This include other physical causes such as injury and smoking. Psychological problems such as anxiety can also cause erectile dysfunction.